Hi guys, it's that time. It's 6 o'clock. So we are in your class 13. And what I wanted to do is just put this up here so I can give you an idea of the illustrations that I was talking about. A lot of this will be more than likely on your test, and they're going to want to know the order of this. Okay, so that's the reason why I just kind of put this up for a few minutes. And you guys can study this with your index cards. Just write down what's in it. It's just a screenshot. But this book that you're looking at, as far as the Bucks 2025, I use that for you guys teaching. Okay, but I want you guys to get the ICD-10 AAPC version. Okay, so the ICD-10 AAPC version is the one I want you to do your coding with. Also, the HICS-PICS AAPC. Okay, so I'm just going to remove this real quick and put up your classes that you have left. So we are now on 13. We're doing chapter 18, 19, and 20. And you know that we always go over pretty much what's going to go on in the classroom. And I always put up um, the link where you're going to get the books from. Now, you guys already know I put everything in the bottom, which, is kind of easy for you guys to get. But sometimes I do like to put this up here so you can kind of copy down the link if you want to. So I'm going to go ahead and put this link up here. This is the link where I would like for you to get the books from. Now, you can get the books also from Amazon. If you go to AMA and get the CPT book, they're probably going to direct you to Amazon. And I would catch Amazon like really early in the morning because they always have some kind of a special going on. I think the Hicks Picks book right now is like $79, which is pretty cool for you guys to kind of get in on. Okay. So let's move this and then we'll go ahead and put up the schedule, which you guys know I always put schedule up. Let's see what's going on. So this is pretty much, let me see if it let me put it up there without. I'm not sure why this is all the way down. Let me see if it's let me put it up. So let me know if you guys haven't got your books already. Uh, you know there are several books that we do need, and I'm not gonna. They are costly. You guys know that they are costly, but I still want you guys to get them, and that is because you can't do the class without the books. Okay, so it looks like my screen is like down a little lower than normal. I'm not sure why. Taking like a minute for me to put up a screenshot. So this is also, it's kind of like a PDF type of screenshots up in there. So this one, I don't know why this one came from the 15, 16, and 17. Because you guys know we're pretty much already past that one. Let me find the one that I'm looking for. Um, Here's one. This one is also the same. Let me see if it pops up. Okay, so this one here, and I think what are we on Saturday, guys? Yeah, so we're on Saturday. So those of you who are new to the classroom, this is the schedule that we go by. Okay, and I did go over some of the stuff that was in my Sapphire class yesterday. You guys can also take a look at those things as well. That was yesterday's class. Yesterday's class, I think it was class 12. Was it y'all? Okay, so yesterday was class 12. Um, don't forget that we will soon start on the medical terminology class. And the medical terminology class, you do need the medical terminology book. If you register for the Sapphire Coding class, you automatically have access to that book. I have the rights to that book, okay, because that's an older version, but I don't think it changes much. But I have the rights to that book, and it's in my classroom. You guys can look at that in the classroom, okay? If you go on the website, I'm gonna share my screen. If you go on that website, um, where is it? If you go on my website, you can register for any class, and you should have access to that. Okay. Hold on. Let's get this. Let's go to the window. All right. I'm going to one window, which should let us do the rest in the same window. I already had this up, so let me see if it lets it goes to the stage. Let's get rid of this, and then it should let us go to the stage. So we're on this page right here. I did want to kind of throw this up here. This is the medical billing and coding Q&A book. Um, you guys can. This is Amazon, straight up Amazon. This is the book that I've written for those of you who are not familiar with medical insurance billing and or coding. If you do not want to register for the class, or you're not sure if you want to follow the YTU, you could always purchase this book, and this book will give you insight on what medical billing and coding is. As you can see, I always have like a little note here, and that's in everywhere. And I think they have the read sample here. You can always go in there and read a little bit. I think my bio comes up first as it relates to that. Um, yes, that is the medical billing and coding book. And I was meaning to put this up here because a lot of people are asking me, they're like, their moms want to learn how to do this. They want to learn how to work at home, XYZ. Well, this is it. When you go to Amazon, you just type in my name, Lisa Lambert, or type in Sapphire Physician Coding. Okay. Um, Let me see if I can go here. This is the website where you guys can get those books from. Let me just kind of backtrack. Here it is. So here, this is sapphirecoding.myshopify.com, which I had this on my regular website, but it kept clashing and you guys were having trouble getting in there. So I took my domain off and now I got it back to myshopify.com. So when you go in there, this is how you see the courses. So you guys who are in YTU, you can use that key code, hashtag key 212. Okay, this is the advanced training course. Everything is in here, and you can download it right from here. All of your courses are downloaded right from here. So if you register from right here, your courses will automatically be sent to you. Okay, and then you go ahead and download them, make your folder. That's your Sapphire class. That's your folder. Okay. The YTU University is different from the Sapphire Physician Coding Academy. Okay. This is the Sapphire Physician Coding Academy. This is my virtual online school, and this is what we work by. Okay. If you want an individual course, you can get an individual course. Like what we're doing right now, we're doing medical insurance billing. Medical insurance billing actually comes with a full course that involves also medical billing and terminology. That's this right here. Okay. But you could always do, separate. You can do one course, two course. Like this course by itself is like $60. It's $53.99. So the course that I'm showing you, that's if you buy it by itself, that's what it is. So once we actually go through eye and ocular anesthesia, all of this is in this one course. You click on that one course, it's going to take you to registration to check out, right? I'm using this as an example. When you come down, I always have like a kind of notes there, something for you to read, something about the program, what's in it, no student loan required. When you get ready to check out, you're going to use that key code. Now, the key code that I gave you is only for this one. That's for the full course. The course is D1211. That $1,150 will be taken off of this. Okay. When you keep going, and it's going to say, do you have some type of a promo or key code or something like that? That's when you're going to put that, key code that I just gave you. And that's that hashtag key 212. Okay. So just kind of keep that in mind. Okay. Because what I'm giving you on YTU is pretty much the basics. When you go into the classroom, you get a little bit more. Okay, and this I think this is my Kindle I was telling y'all about. It's Grandma Lisa's Kindle. So I remember I was saying half of those books you can get in Kindle, and you can read. I don't know. I'm thinking like 100 pages or so. So when they say sample, I mean they're not kidding. You actually get a sample. You get a lot from there. Okay, so that's what I wanted to kind of let you guys know. This is also the Kindle, and this is the free portion of the Kindle. This is the CPT book. You remember I was telling you about the CPT book. Now this is free. There's no copyright here because all this is actually like a PDF, but it's a free version of it. So you're not copying anything. It's still a Kindle and it's still, pretty much free. Okay. And you see where it says shared link right here? I literally can share this link with you if you need it. Okay. Because this is like the free version. You get like a couple of pages free, XYZ. Um, and this is how you can study, especially if uh if you don't have your book yet. I definitely would do the Kindle thing if I don't have my book yet. So because yeah, you're gonna need your book. So let's take this down. So you're definitely going to need your book. And like I said, the Kindle has books that you can use that are like the first 200 pages. You saw the things, like it was like 1,100 pages or something. I don't know how far it goes because I've never actually looked at the whole thing. I think I might do that today, look at the whole thing and see what it's about. um I did put something up there that I wanted you to see before we actually start the class. Yesterday we were talking about the AAPC. This is where you're going to take your test, right? We were talking about what was on it. So let me share my screen with you with that. This thing is a little low. I'm not even sure why it's like that. It's never been like that before. I'm going to take some of this off. Remove from studio, because we usually spend more time on the introduction in the classroom, but I'm not spending that much time on the stage. So share screen. Where I'm taking you to is AAPC. Okay, and what's the problem here? AAPC. Where are you? Actually shows you some of what's going to be on their test. So you guys remember when I told you that yesterday, you can go on aapc.com and they'll show you what's going to be on their test. How many questions is this? How many questions is that? Now, if you get the test, okay, they're not going to tell you exactly what's going to be on your test, but they are going to show you the minimal of what you're going to see. So I'm going to show you that right now. And there's no copyright or anything for that. That anybody can see this. Okay, I'm just going to go and look at my view, and then you can see your view. So this is where you're going to take your test. This is AAPC. You guys can always go to aapc.com. This will give you insight on what to expect when you're taking your exam. You see where I'm at? Taking your exam, taking the CPC exam. That's AAPC. Who should take the CPC? What to expect on the exam day before you begin your test. Take a moment, a breather. You have 4 hours to finish. The questions asked has 17 areas of knowledge, most of which are presented as coding scenarios. So you guys can take a look at this yourself. I want you to definitely take a look at it to see what you're getting into. Live remote proctor exam. They're talking about the online one. So let's just kind of move down. I just want to kind of show you what you're going to see. Let's look at this piece right here. You see this right here? Uh, this is for the online equipment required, XYZ. If you're going to a testing center, location, there's a college, university, or a facility. Exam, 100 multiple questions, 4 hours. As you guys remember, it was a lot longer than that many years ago. Not many, but at least 4 or 5 years ago. Cancellation, rescheduling. Okay, so passing grades is 70. You guys all know that. So let's just kind of scroll down. You guys will have a calculator. Remember I told you that. You tab your book. Remember I told you that. All right. So you guys see this right here. This is what I was talking about. I don't know what that was. This is what I was talking about yesterday as far as what's going to be on that exam. Now it gives you an idea. Look. Medical terminology, 4 questions. You're going to have 4 questions on medical terminology. Anatomy, 4 questions. Body, compliance and regulatory. Okay, HIPAA, stuff like that. High tech, stuff like that. Coding guidelines. Remember I told you about the coding guidelines? Look how many questions you're gonna have in coding guidelines. 7. So you have 7 questions on the coding guidelines. Don't forget CMS.gov. If you don't have your book yet, that's where you're gonna start studying from. You can start that right now. That's free. I'm gonna show you that in a few minutes. ICD 10 CM. How many questions you gonna have, Miss Lambert? 5. Okay. This area will test your proficiency in diagnosis coding within all the chapters of ICD 10 CM, as well as through knowledge of the ICD 10 CM guidelines. Everything is all about the guidelines. That's why I told you, read it. I don't give you read it 50 times. When you start retaining that, that's when you know you're good. When you start reading it and you reading it ahead of yourself, you know it. Okay. Hicks Picks level 2. You're gonna have 3 questions on that. 3 questions. They are literally telling you This is my pet peeve right here on the guidelines. 7 questions. That's a lot of questions. This is an open and closed question. All right. It's open and closed question. So let me rephrase that. You see how these look like this? 4 questions, medical terminology, 4 questions, anatomy, 4 questions. Those are open and closed questions. Look what they're going to talk about. They're telling you this is what we did. Did we just go over some of this? NCCI, NCD, LCDs, local determination, HIPAA, ABNs, RVUs. Now, we went over that. Did we not go over this in medical insurance billing? This class is winding down, but we've already went over some of that. If you get stuck, if you don't remember, go back. I fixed that thing this morning to make sure all of them say Sapphire, ED, CLS 1, CLS 2, 3, 4, so that if you did not get on in the live class, which most of you will archive it, okay? So that's the reason why we did that. Don't sleep on this, okay? I'm going to go back. I'm going to go back to it. Okay, so ICD-10-CM, 5 questions, CPT, 6 questions, 10. Okay, hold on. Wait a minute before I get to that. HCPCS level 2, 3 questions. Okay, this section will test your knowledge on HCPCS level 2 coding. HCPCS is going to be easy, but HCPCS has modifiers and stuff like that too. It's medication. We haven't got to that part yet, but we will. But I think you're going to ace that. All right, so here we go with the CPT. 10,000 series, 6 questions. Okay, 10,000 series. That's what they are. They see when we get up there, I'm gonna tell you how those series go. Okay, 20,000 series, musculoskeletal system, 6 questions. Okay, 30,000 series. You can get any one of these series. Okay, 40,000 series. I'm not sure if that's diabetes. Yep. 50,000. What is that, y'all? GYN pregnancy. 60 might be cardiology, radiology. You're gonna have 6 questions. This is where you're gonna have the problem right here. Did they get to the cases yet? Anesthesia, 4 cases, 10 cases. So don't look right here. You see all this right here. If it don't say cases, it's not gonna be cases. Okay. If it doesn't say cases, it's not cases. So what we just looked at was open and closed questions. You're gonna have 10 cases. That's where you're gonna actually do the coding. That's where you're gonna actually do your coding at. So let me get back over here. So you see where it says 10 cases, right? Each case will test your ability to accurately code medical record documentation using CPT ICD-10 level 2. So the rest of this is open and closed questions. You don't know which ones you're going to get. Okay, you don't know which ones you're going to get, but your best bet is to make sure that you study them all. So as you can see, a lot of what we went over in here, especially as far as that medical billing. So you guys remember I told you there will be some medical billing in there. You see that? That's why you have to do medical billing. Coding is not just coding. When you get out there and you're actually doing it, it's coding. When you are testing, it's a pain in the swank. You got to know everything. Do you have to be the surgeon? Sometimes you have to be the surgeon. This is the reason why you have to do medical insurance billing. Okay. See, I'm spending too much time on this, but I wanted y'all to see it. I'm gonna put it up again because somebody just come in. You see this medical billing in here? You that just came into this classroom. That's what we went over. Medical insurance billing. This is this AAPC.com. You see this breakdown right here? This is what we just finished going over. Compliance, regulatory, ICD-10. These are what you call open and closed questions. You see how they are open and closed questions? Now we get down here, 10,000 series, right? 20,000 series, right? 30,000 musculoskeletal system, 30,000, 40,000 diabetes, 50,000 OBGYN. These are more than likely open and closed question. Radiology, open and closed question. Medicine, open and closed question. E&M, open and closed question. 10 cases. So you see how we got all the way down there? Those are the cases that you're going to do. Okay, I'm going to take this off and I'm going to put this back up here. So right now we are in class 13. We're doing 18, 19, and 20 because I can't spend too much time on that, but I definitely want to show you that part. Okay, so let's see where we're at. 18, collection strategies. We're still in the workbook, Fortney's workbook. I'm going to put this up real quick only because the workbook is there and you guys can see that. So let me see if it's letting me. All right, hold on. The medical billing, get out of here. Medical billing. Okay, let's take this down. Let me see what's up here. Okay, that's the end. Okay, I got to split my screen in order for you to look at that. I'm going to do it now. So We are on the medical insurance bill. I just went over AAPC with you guys. AAPC, I just went over and what's going to be on that exam. So you must remember, AAPC always gives open and closed questions. Okay. And those open and closed questions will consist of what we just went over. You're going to have 10 cases. Okay. And the rest of it is open and closed cases. I'm gonna shoot that back over only because I see you guys coming in. I'm gonna show y'all what's gonna be on that AAPC exam. I'll share my screen with that. So we're gonna look at that one little bit because I don't want you guys to admit. You see this right here? Those of you who just joined the class. This is AAPC.com. Do not sleep on this, especially when you guys are getting ready to take your test. What we just went over, medical insurance billing, is here. You see this? This is a breakdown of your exam, AAPC. Medical terminology, 4 questions. You see? Anatomy, 4 questions. These are called open and closed questions. You see the guidelines right here? Remember I told y'all the CMS.com. If you want to look at, I'm sorry, I didn't even look at that. This is it right here, okay? If you don't have your ICD-10 book, don't worry about it. Go on cms.gov and get those guidelines. So this is what we're talking about. Breakdown, 100 questions. Medical terminology, that's your next class. Don't forget that. Anatomy. Anatomy is the illustrations that we was just talking about. Remember I showed y'all the illustrations? When we first opened this class, I had an illustration up. If you didn't catch it, you guys are going to have to archive this class. So compliance and regulatory. Remember we went over that? Medical insurance billing. Then we went over Medicare Part A, B, C, D, NCCI, LCDs, HIPAA, ABN. You guys remember we went over that in the prior class? Make sure you do that because it's going to be on your test. Okay, so let's move on. I gotta get to this. I gotta get to y'all's medical insurance billing, and it's really quick. So this class is not a class that's going to be really long, but I do have to get through the book with you guys. Okay, so let's. I hope that's the one that we're going through. All right, so we're just going to put this up because you're on chapter 18, collection strategies. Okay, so don't sleep on that, and you guys can retrack on this chat so you can go back over that. I don't know, something bit me down there. I don't know. Okay, so again, these are the key terms, and everything is educational here. So more than likely they don't flag us, but we're waiting for our paperwork from Elsevier. Okay, so these are your key terms. Make sure that you are writing down your key terms. Okay, I'm just going to take this down and just put this up to make sure that you guys have your schedule and know that this class is getting ready to end. So, in your key terms and collection strategies, they're pretty much just telling you before you file an appeal, before you call the supervisor to the insurance company or XYZ, just make sure you have everything in order. If the patient has filed the bankruptcy, make sure you check and see. If it's an accounts receivable error, make sure you do your due diligence and find out. If you got an issue where the patient is calling with a credit card, the credit card didn't go through, the patient is in collections, y'all already sent it outside, and it was error, pull it back. Why, Miss Lambert? Yes, you can pull back a collection account. Okay, so if it was an error, go ahead and pull it back. If you need to get my permission, my permission. Whoever your director is, you can get their permission to pull it back. Okay, check and see if there was any garnishment. And watch that bankruptcy if they file a bankruptcy and they didn't give you the paper, that's a different story. But they're supposed to give you that because the law says you can't go after them after they have that. It's a process. Okay, so I'm not going to go through all of that, but we are going to go through the key abbreviations. And again, this chapter is I'm gonna throw this up here. This chapter is really us just kind of going over what we previously did. They're just throwing the extra work in it to make sure that you get it. As you can see, NSF and W2 and all that kind of stuff, I want you guys to make sure that you get that. Okay. I'm just going to throw that up to make sure you guys have the website for the book. Okay. And this is the same. Remember, we're working in the workbook. We're doing the workbook because we've already done the reading. So you're going to collab with both of these books, the medical insurance billing book for workbook and the medical insurance billing for the reading. Okay, your study outline. And you guys remember what I said? Basically, it's the same thing. This chapter for collection strategies is making sure that not only you collect funds that are owed to the hospital or owed to the physician, this is also when you're collecting co-pays, you're collecting deductibles, you're collecting any type of payment. If you're in a collections department, you're going to have patients calling you in, giving you payments over the phone. They will show you how to do their payment system, which is probably inside of Epic or Athena. Okay. Self-pay billing is also in there. Some patients like to mail in their funds. But you will get a lot of that. You open it. That's the same thing in the finances. You're gonna put that money in there. At the end of the day, you're gonna get your report to your director or your supervisor. Okay. So again, make sure that you send out to correct appeal letters. If you more than likely your office probably has a general appeal letter or a general collection letter that we normally send out. It might be letter 22, letter 24, or something like that. And, it's already done. You don't have to do anything with it unless you feel like we sent that out and nothing happened. All right. So then you want to write one and you'll make sure you get your supervisor to approve the letter that you want to write. Okay. Assignment review questions, which is the same thing that we went over before, but in this case I want you to make sure that you do the reading for this one. Your assignment for the fill in the blank, for this one, let's get rid of this. The fill in the blank for this one is a little rough, so you're going to have to spend a little bit more time on this one. When you get down to these chapters like this, it's a little bit more funkier than the other chapters. They were a lot easier because here is the gusto of what you learned in medical insurance billing. Um, if you forgot something, then yeah, you need to go back and archive that. I'm already 27 minutes. I don't know what happened. I don't know how we lost track of time. Because y'all know I can't wait till we get to the coding. Boy, I can't wait till we get to coding. That's why please make sure you have your books. Catch Amazon 5 in the morning, 3 in the morning. Sometimes they had them crash sales. Okay. You could even get my book at 3 in the morning. I think I saw a crash sale on my book. It was like $15. And that's for the hard copy. Now, for on my website, you will get the ebook of my book. You get the ebook. It's only $15, but you can go to Amazon and get the hard copy. I'm going to finish the medical terminology book tonight. I'm going to try and finish that book tonight. Um, I'm getting ready to switch over. We're not going to do that. When we do the capstone, we're going to go over all of that. When we do the capstone, I'm going to show you all of that. What I'm going to do is make sure that you have everything that you need. I'm going to go back in here. I want to pull up. So we got that book pulled up. Let's pull up this one as far as the medical insurance billing. Why is this like that? Hold on. I'm trying to pull up both of my books. Okay, here's the other one. Let me see if we can open this one. Okay, here's the other one. I'm gonna switch out because I didn't get to show you. This is Sapphire Physician Coding Series 1. So I have an 18 series of medical insurance billing book. And I also have the medical terminology book. And this is for those who do not know anything about medical billing, do not know anything about coding. So yes, Miss Lambert writes books. I have several books that I have written to help you guys out, especially those who are not familiar with medical insurance billing. And if you've missed the course that we just went over about 5 minutes ago, as far as what's going to be on the CPC, when I finish with this, because this is live, just backtrack and go over that, and you can see what's going to be on the CPC. You'll also see how many questions as it relates to the cases is going to be on the CPC. Okay. But right now, we're just kind of going to take you to the Sapphire Physician Coding Series 1 Medical Insurance Billing Training Guide. As you can see, Lisa Lambert's name is up at the top of that book. So this is just one of the books that I have written. And this book, again, is for people who are not familiar with medical insurance billing. And this is also for people who can't come to a class, often, because we only do this class 3 times a week. But in my regular school, the Sapphire Virtual Course, you can do it every day. You can come in there every day. So that's the reason why I'm just kind of throwing this one up, because we already put the other book up. Okay. And here you can get this information right here, which just kind of lets you know what the book is about. Okay. So we're going to take that down because I don't want to take too much time away from you guys for the rest of this class. And again, this is a short class. And let's remove that. This is a short class, but it is almost done. This is class 13. Monday you will have class 14, and it's 21 and 22. And we're going to do that class because that's the job development class. Some of you were asking me to do it, which is fine. That's why I just said, okay, we can go ahead and do 2021 on that. Okay. So now we are back to chapter 18. And again, these were your collection strategies. This is your collection strategies. We're not going to leave it up long, but this is generally telling you how you're going to collect money from somebody, how you're going to do an appeal, how you're going to talk to the insurance company on the other side when they send us an EOB and they say we paid this, or they say we're only giving you $10 and they should be giving us $80. So you're going to fight for your claim. Okay, that's what the collection strategies is about. Okay, so you're going to work in your workbook, your Fortney's workbook. Okay. Now, if you guys don't have your book yet, don't worry about it. You can backtrack and then you can get your book and you can start again. Okay. That's the reason why I decided to put these also on here, because I wanted you to have the opportunity to archive your courses. So this is 19, Introduction to Healthcare Facilities and Ambulatory Surgery Centers. Now, again, this is a workbook. Remember, you've already read this. Okay, you've already read this. So what we're doing is working in the workbook. I'm just putting that up there so you guys can be reminded that this class is almost over. So your 72-hour rule in a summary. You guys are to do a summary of what is the 72-hour rule as it relates to Medicare. What is accreditation? Y'all know I can't half say it. What is activities of daily living? That's a good one. Put that in your summary too. In your key terms, just pick out 2 or 3 things. But again, you've already read this: ambulatory care, ambulatory surgical center, ambulatory surgery units. Tell me what they are. Capitation, what is that? Charge master, what is that? You see how this coming down to everything that you've already done, but it is relating to ambulatory surgical centers. That's like it's almost like urgent care centers. You go, you have something done, and you leave. You're going home. Okay. Hospital acquired conditions, inpatient only list. You guys may not see that. Depends if you're working in medical systems. Those of you who are medical systems, you might see some of that. The coders, you're not going to see that. The billers, you may not see that. Prospective payment system, that might be on your CPC. Okay, that might be on your CPC. I'm gonna pull this up real quick. Right here, that might be on your CPC. That prospective payment system. Um, a couple of people have told me that it was on their test. Okay, revenue codes, revenue cycle. Okay, revenue codes. Where does the revenue codes go? The UB04, UB92. You see those codes there. Okay, abbreviations. Same thing. Make sure that you also put these on the index cards. And you can see some of them are repetitious. They're kind of repeating. Depends on where you're at. Up the MSDRGs on your test. MSDRGs on your test. They might say, what is it? Or what does it mean? Just make sure you study it. Okay. I didn't put all your books up today because we always put the books up, but just make sure you get the Ford Needs book, okay? And look down below. All the links are below. I went link crazy, so y'all got a million links down there, okay? So I'm on page 267 for those of you who do have your book, Revenue Cycle and Healthcare Facilities. And this is what's in this chapter that you've already read. Pre-admission, patient cares, charge masters, postage charge. If you don't have your book, do the Kindle. Do the Kindle. The Kindle will let you see a lot of that book, okay, until you buy it. Okay, I don't even know if there's a cutoff of it because I've looked at the books several times. I have them even in the Sapphire Academy. So, I don't know how long they'll let you look at it. Okay, so what organization developed the Healthcare Facilities Accreditation Program to evaluate osteopathic hospitals? TJC, AMA, AHA, AOA. Okay. What is this? This is multiple choice. Okay. So there's multiple choice here. There's true and false. I like this one. A list or database of all services and supplies. You already know what that is. Yeah, I'm not giving you no answer to any of it. I'm just kind of going over what you should be doing. So where we're at right now is in introduction to healthcare facilities and ambulatory surgical centers. Let me take this down. So some of you might, maybe you decide to do coding for surgical centers and not, not a physician's office or not a doctor's office. When I was in Connecticut, I went to a surgical center. They didn't do their coding, so I'm pretty sure their coders were off-site, or they may have been coders that live, someplace else. But again, when you become a coder, you are looking at one thing, reports, and you're coding them. Um, if you register for the Sapphire class, we kind of go more in depth, and then we do one-on-ones. So when we do one-on-ones, you get a lot more than what you get in the YTU. There's only a certain amount I can do on the YTU, but in the YTU University, as you can see, what we go over, and I give you a lot of what you need as it relates to you taking the test, just like as if I was standing in front of my classroom. The only difference is between me not standing in front of my classroom is that you're online, and that you should be at home. You should have your desk, you should have your paper, and you should be taking notes on what I'm telling you. Um, do not forget, when I show you things on AAPC, take heed to that, because what you've just done in the medical insurance billing course is going to be on that test. You've seen it. You've seen it. Some of you who just popped in and you didn't get to go over the AAPC with us, check out their website, and you can see the same thing. Everybody, check out their website, aapc.com, because they tell you what's going to be on the test. You see at the bottom, there's going to be 10 cases on the test. The majority of the test is open and closed questions. We just went over the majority of what's going to be on the test. When we get to the coding part, we're going to do so much coding that there's no way you would not be able to decipher it. But you have to do the medical terminology course. So I'm hoping everybody who's looking at these videos and archiving the videos, make sure you guys ride with me on the medical terminology so I can show you guys all about that. Okay, so I'm gonna go back to the book. I'm just looking up here. Oh, so I did want to show you. I did want to show you this one. Well, we went over that, but I did want to show you that one. And this is just basic, the basic website. And I make sure you guys got that website. So it's cms.gov, ICD-10 CM 2025 coding guidelines. That's what you're going to type in. It's ICD-10 CM official guidelines for coding and reporting. Okay, for coding and reporting. You're going to be tested on this. You're going to be tested on this. Okay, let me put this in here. Um, Y'all saw this plenty of times, but I'll go ahead and put it up again. Today is the 12th, right? All right, so you guys see that? Oh, let me put it up. All right, so you guys know I put this up. This is free knowledge. This is nothing that has to do anything with copyright or anything. You can go on CMS, and even though we just went over AAPC, you see how many questions are in there on those guidelines. I just showed you. There's 7 questions on the guidelines in the AAPC. Okay, so just make sure you take heed to that. All right. And I just pulled it up just to kind of show it to you again. I was thinking that the website would pop up, but the website again is cms.gov. Okay, so let's go ahead and take that down, and then we can go back to where we were. So again, you can use that until you actually get your book, because which one is this? Those books are hefty. CPT is like 127. Okay, but the good thing is you don't have to get the books all at one time. You don't have to get the books all at one time. The course is free. I'm telling you, you don't need to get a student loan for medical insurance billing. I mean, so many women that are in like college for it, and I did too. I mean, I wasted, I don't know, it was about $27,000 about 15 years ago going into that class. Let me see. Yeah, about 15 years ago. It was like useless. Like I could have taught myself stuff that they taught me. But I'm not gonna let you get no student loan. Okay, we're not gonna let you get a student loan. You want to learn right here. Okay, tell your friends, tell your people they need to subscribe to Miss Lambert's channel. Okay. And you can also join. Go to sapphirecoding.myshopify.com or send me an email. Okay. All that information is down below. All right. So again, introduction to healthcare facilities. This is chapter 19. Okay. I'm backtracking. Let me see if I look back here. Okay. So we are just pretty much talking about ambulatory surgical centers and healthcare facilities. And this is the workbook. This is the workbook. We went over this already in the reading material. Okay. We're only looking at the workbook. Okay. And I'm just showing you how everything is multiple choice in this section. This is your book that you should be in. So those of you who are with me and you got your book already, this is where you should be. Okay, so remember we did the reading already. You should be in here. And you guys just saw we just went over AAPC. Okay, there's going to be 6 questions on medical insurance billing. Okay, 6 questions on medical insurance billing. That sounds like a lot. I'm telling you, when you get there, it's gonna be a lot. All right, it sounds like a lot to me. I don't know about y'all. Okay, so ASC. What is ASC? I just told y'all, ambulatory surgical centers. Good. All right. I like this one. What type of rate is the IPFPPS based on? I don't know if it's going to be hospice questions on there. I doubt it. And remember, this is for if you don't want to go all the way to your coding, just steadfast on this, and this will help you with medical insurance billing. Okay, I can't give you a certificate here. Certificates are only for people who actually do the class, the Sapphire Academy. So that's the one thing that I can do here. You guys don't get a certificate. If you join my class, you register for Sapphire Physician Coding Academy, then yes, you get a certificate. You don't get a certificate here, but you do get the skill. Okay, I'm putting you in the right place. Okay, and then don't forget that's your capstone right there. That's your capstone. What time is it? Okay, 42. What's going on right here? Okay, so there's also true and false here. Um, Acute care facilities provide services only on an emergency basis. That may be true or false. It's going to be true or false because it's one of your questions. Okay. And don't forget, when you look at this book, there's so many illustrations in this book alone that will absolutely help you. Though this is for those of you who are actually going on to take your CPC exam. Okay, list 5 examples. That is amazing. I can't believe it. Amazing. And the critical thinking. Do not sleep on the critical thinking because this part is where you're going to start getting to your pre-authorizations. Okay, calculating your MSDRGs. I'm on page 271. I just want to show you this quick. If you guys have your book, I'm on page 271. Take your time with this. So I'm thinking that you're going to need more than 2 hours for 18, 19, and 20 because this is you getting down to the end. What I say, 17, 18, 19, and 20. These 3 chapters are a lot harder than the ones that you just went through because they're putting everything in here almost in a nutshell. The 14 is going to be your 21 and 22. Your 21 is that job course thing that I said I was going to go ahead and do. And the 22 is pretty much a couple of tests that they got in there that we're going to go over. That's class 14 for Monday. The capstone on this class is going to be next Friday. The capstone is us going over everything. So that class will probably be about 2 hours of us going over this. And I'm probably going to go over the AAPC again. Make sure you guys check aapc.com. You see what we just went over, what's going to be on that exam. If you want to join the Sapphire registration course, please let me know. You can use that $1,150 discount. I also have, like I said, the other courses in there are like $53. And sometimes I'll have courses in there that are like buy one, you can get an additional course. So, just, don't sleep on that. Just make sure you get this extra stuff for you to do. And this is for those of you who are in the YTU. Okay. So remember, this is a real university type of class. This is the same type of stuff that I would teach. If I was physically in a class, you're just not getting everything. So you can imagine what I'm giving you right now based on it's just a small part of what we actually get in my classroom, in my physical school. Okay. So look it up, type it in Sapphire Physician Code LLC. I'm a real school. It's not, I've been around for years. So, this is not new to me. So trust me, I'm giving you what you need. And don't forget my books, Medical Billing and Code and Q&A. Get the book if you don't know anything about medical insurance billing. Okay. I love this part right here. Look at the table. I'm on page 272. If you guys got your book, go to page 272. And you know what? I see they changed the CPC. They used to have a calculation in there with MSDRG, but I want you guys to go ahead and do this calculation. If you want to join the Sapphire Coding Academy, let me know so I can put you in there. We actually do this calculation in a class. I'm going to work around the classes in the YouTube and eventually start doing the classes longer there, but mostly on the one-on-ones because there's only like a handful that's actually up to the MSDRGs. Okay. All right. So 20, billing for healthcare facilities. We are up to 20. Okay. And again, this is for those of you who are only going to do medical insurance billing, and then some of you who are going to the code and you might have this much medical billing in there. Okay, so again, we always start with the keywords. And remember, this is the workbook. Okay, you guys are already doing the reading, right? Remember, we already went over the reading, but you're going to combine this. You need both of your books right in front of you. If you have an older book, that's fine. You just gonna have a different page than me. There's not much that's actually changed. Uh, I would prefer you have the new CPT, ICD-10, and HCPCS book. My ICD-10 book and my history book are from Elsevier, but I use those for teaching purposes. You guys just go ahead and get the other one. I just ordered the hard copy of my CPT book because you guys see my CPT book is also an ebook. But I'm going to order the other book because it's easier for me to teach. It's easier for me to teach online with the ebooks. Okay. Um, the CPT course. In your medical insurance billing, you guys remember chapter 11, 12, and 13. So medical billing does have that little small portion in there. Even if you're not going to go on to medical insurance billing and you want to learn more on the coding side, those of you who are just doing the billing, you can jump into that class. But the next class that we're going to do is the medical billing. Is it medical billing? There it is. Okay. So this is the next class that we're going to do. Okay. This is the last chapter we're going over as far as 20. But this is what's going to be next. Okay. Let me put this down. So billing for healthcare facilities. That's what we're up to right now. So you guys should be on the same page that I'm on right now. Okay, you're gonna do your key terms. Okay, you've already done the reading. You could put your reading book together so you can get this. So you can get this really quickly. Qualified characters, uniform bills, and there's only a little bit in here. PPS, UBO4s. They just want you to write down the definition of what this is, and you see how it's repetitious. There's no way that you can't. You're not gonna get this in your mind. Because you guys already saw it. Some of that's in there. Study outline. See, look, introduction to facilities billing, first listed diagnosis. It's in here too. But again, this was already in the reading, so you guys already knew you needed this. Okay, section 1 of UBO4, provide information, billing information. That's on the 1500. They're just showing you what you're going to identify there. You remember in your book, there's going to be a blank 1500 form. Okay, don't mess that up. It's only one. You can take it out your book and make a copy of it. If you've already written on it and it's wrong and you didn't fill in it right, let me know. I'll send you a blank one so you can do it. Okay, send me a message. I'll send you a blank HICPA, and then you can start over, especially if you've already done it in pen. Okay, diagnosis information goes on there. Section 5, Section 4 goes to payer information. Actually goes there. Section 1, the provider information. Okay, let's see. They fill in the blanks and review questions. So again, this is billing for healthcare facilities, and this again, this they're just really telling you what's going to go on that claim. Okay, what's going to go on that claim? And in this chapter, I'm on 277. They show ICD-10 PCS. ICD-10 PCS is procedural services. That's hospital codes. That's hospital procedure codes, right? That's what ICD-10 PCS is. That came out when ICD-10 CM actually came out. Okay, I did teach that in my other class, but you guys don't get a portion of this here. I got a little small skit in the classroom, but I don't do a whole drawn out thing of this because this is hospital code and it's more of a HEMA. Okay. List four, list of four root operations used when the procedure is performed on a device and not a body part. Wow, listen. I want y'all to do that one. Do a summary on that after you do it. Mix and match. Oh, I like this. I can't repeat the whole thing because I'm gonna show y'all because I want y'all to do this. I want to make sure y'all do this because this is something y'all need to do. Okay, make sure you do this portion. Make sure you do this portion. This is a mix and match portion, but y'all should be good. Y'all should be good to go with this because we've already done all the other stuff. Okay, all those chapters we've already done. This is you guys' 13th class. This is the 13th video on medical insurance billing. Chat number 14 will be Monday. Okay, so you guys got classes Saturday, Monday, and Friday. Okay, so when you do this class, it should be time for you to do. I don't know what this is on my finger. It should be time for you to do your study. So this is your hour of theory. This is your hour of theory. What's theory, Miss Lambert? Reading, practicing, reading, not practicing, reading, classroom, teacher, talking, theory, getting it all together. Practice. Remember, I showed you theory and practice. You could, this is an example. This is not on my crosswalk because there's no way I could remember that crosswalk. 100 hours of theory, 100 hours of practice. Here we did, this is what, 15 classes? We did 15 hours of theory. We did 15 hours of theory. Okay. The practice is how much time you spent on that workbook. So the workbook that we're doing right now, let's say let's say after class you spend 2 hours. So if we did 15 hours and then you do 2 hours of theory, that's 15, that's 30 hours of theory. Okay. So you did 15 hours practice and then you did 30 hours theory. Okay. So and I need to know that because for the YTU, when I make the crosswalk for the YTU, I have to put that in there. So and I already know how much time I spent on your theory because I every time I do a class, I do it for 1 hour. Once or twice, I might have did an hour and 20 minutes, but that's the theory that I did on your class. Okay, the practice should be at least 30 hours. You see what I'm saying? So when we say at least 30 hours, your Monday, Saturday, and your Friday, 3 hours. You should be spending 3 hours on work, 3 hours on school. Okay, 3 hours on school. So let's say today's one of your days. First hour, theory. Second and third hour, practice. Practice. What's practice, Miss Lambert? Your workbook. Your workbook. Okay. Um, Now, if we get to medical terminology and you guys are not finished, you can go ahead and do a double, do a split. But right now, your practice in theory is 15 and 30. Okay, for medical insurance billing. That's for YTU only. Has nothing to do with Sapphire. So Sapphire, y'all ain't got nothing to do with this. Okay, y'all just totally different. Okay, this I'm talking to the YTU students. control, destruction, detachment. Oh, okay. So this is just definitions that they want y'all to do. Taking or cutting, cutting out. Oh, I like this. I like this. I'm on page 280, y'all. Multiple choice questions and open procedure. This is on your test. They're going to have differences of what an open procedure is and a closed procedure. An open procedure performed with endoscopic assistance should be coded as. Okay. And they giving you a couple of coding things down here because you had that little skit. Remember 12, 13, and 14, I think it was? Let me see. Yeah. So remember when we did chapter 12, ICD-10 CM, chapter 13, CPT, chapter 14, HCPC. Okay, they're saying you should know something about coding a little bit. You ain't got to be doing the whole long drawn out cases. That's for the coders. Okay, that's for those of you who are going on to do the coding. Okay, but they do give you a little bit in the multiple choice section right here. Okay, you got your true and false, critical thinking. A patient has a hearing aid assessment for a condylar implant. You remember that thing I put up there? Is it still there? Let me see. Oh, I thought I put the ear up. Okay, hold on. And I'm only putting it up here because we started talking about, they mentioned condylar implant. I'm going to show y'all what a condylar is. Hold on. Because I was going to put this one up. Condylar, there it is. Okay, so I'm gonna share my screen with this. So you remember what I was telling y'all about the illustrations? All right, let's get rid of this. Remove that. Let's do this. Stop to share. Start to share. I don't know which one it is. Oh, it's this one. Okay. So I wanted to put this up because we're talking about the condylar. See? So that question that this is just a screenshot. It's okay. That question that we just finished talking about as it relates to the condylar and chapter 20 relate to this. When you get to that, relate to this. Even though you got your workbook and your reading book, this is what they mean by illustrations. Remember that the AAPC that we just went over, you got 6 questions on this. This is what I'm talking about. So make sure that you steadfast on that. Okay, that's the condylar. What we were just talking about. All right. So I'm just gonna put this up there, okay? So I'm gonna get out of that. I gotta stop the share and then share again. Now, I know I gotta stop the share and share again. Okay, so that what I just gave y'all related to that question, okay? All right, let's see what else is in here. This last part you don't have to do. You don't have to do all this last part right here. I mean, there is a UB92 in here, a UB04 in here. If you want to, you can absolutely complete it. But there's a lot of questions on ICD-10 PCS in here, and they didn't give us that in here. I didn't see enough for you guys to learn that. That's not going to be on your exam. You do not have to do that. Okay. And that's in 20, billing for healthcare facilities. Okay. But you still can do what is the type of bill code that would be entered in FL4. They talk about the UB04 encompass the patient's entire admission. Now, this is a report. I'm going to show you this. This is a report. This is what's going to go in there. Oh, remove. You see, that's the report, right? And that's the UB92. Okay, so no, you don't do that manually, but they just kind of giving you an idea. I got 2 minutes left. Okay, well, we're finished with this course anyway. We're finished with this course, and that was pretty much the last thing that I was going to give you. Monday is you guys see what the next 2 things are for Monday? Right there, seeking a job, attaining professional advancement, and tests. Okay, so that's what we're doing. Basically, what we just did was actually the conclusion of the medical insurance billing. The class 14, 21, and 22 is the job skills, the job event. Okay, so this class is really finished. Monday, we're pretty much going over 21 and 22, and we're only going to do that because somebody asked us to do this. which is fine. You guys know in the Sapphire class, we have a whole thing on job placement questions and XYZ and resumes. Again, anybody in the YTU wants to get in on that, let me know. I will put you in. Look down below for all the websites for the book. Look down below, and you will be able to find where to get these books from. I'm going to put this up real quick. We can end with the Elsevier website. This is where you're going to get your books from, and also Amazon.com. Okay, make sure you have your books when you're doing those ICG 10 portions, and make sure you look at AAPC.com. They're literally telling you what's on the exam. So I'm out of here. I hope you guys enjoy this. I'll see you again on Monday. Don't forget, Monday is Job Development Day. Okay, that's what we're going to be doing, job development, and we're going to go over some tests that are in here. So if you guys are doing the tests, let me know. Okay, and don't, the answers are in the back of the book. Don't cheat yourself. Just do the test and then grade them yourself. Okay, bye bye. I'll see you next time.